A big meeting yesterday between our top health officials and health officials from the UK, where the fact that we're still on the UK's red list was on the top of the agenda. Last week, the British government said people who go from South Africa to Britain would have to quarantine for 2 weeks, even if they've been vaccinated. They specifically talk about how they recognise the Pfizer vaccine, which is the same as you would get in the UK, and yet they say they don't recognise vaccinations conducted in our country. Dr. Mvuyisi Mzukwa is the Deputy Chair of the South African Medical Association. Dr. Mzukwa, good afternoon to you, and thank you for your time. I would imagine that our top scientists had a pretty strong message around science for British officials.
Good afternoon, Steve, and to your viewers. Thanks for having me in your program. Definitely, Steve, you would expect that our scientists in South Africa would obviously put across scientific facts. Hopefully the system that they are using in the UK is based on science. We've got few issues that are pretty obvious. The first one is that our caseload is down. The numbers have gone down. We're not hiding that information. But also, they are worried about a beta variant. I mean, that's not a dominant variant in this country. We know that Delta is the one that's dominant, and more than 90% of cases in the third wave. So I honestly don't know why you would want to discriminate against South Africa when you have in your own yard a variant of concern. So I do think that they would consider those things, and they would push those things forward so that those scientists would consider taking South Africa out of the red list, because it's pretty obvious this country is not a risk zone in terms of COVID-19.
And I mean, and everyone's made the same point. If you get vaccinated here, you're getting the same vaccination that you'd get in the UK. I mean, it just makes no sense.
Very true. That really took us by surprise. You wouldn't want to think that a country like the UK would use such a backward reasoning, if I may call it, honestly, to put or to base their criteria. I really don't understand, because we're using the same, it's coming from the same company. There's nothing that we have changed. So I really, that one I don't know how to explain it. But if they are talking science, I think they've gone out of the borders on this one.
One of the things that might be slightly concerning is not the vaccine, not the quality of the vaccination, but proving that someone has been vaccinated. So, for example, when I got vaccinated, I got the Johnson & Johnson vaccine. It was really a very easy, it was a simple card that someone filled in, and it would probably be, I'm afraid to say, pretty easy to fake that. Could that become a little bit of an issue here, where one government might be worried about whether or not people coming into that country, into their country, actually have been vaccinated because of the possibility of faking vaccination certificates? I can just see people scratching their heads over that.
Yes, Steve, that would be a consideration, but you'd remember that we have our own ways of verifying, which we should be sharing that with the international community. For example, there was a case where there were fake COVID-19 tests. I think that's what muddied the waters, making it, people not trusting the country. But I think that was just one isolated incident that I think it was clamped down. And I do think that we have reliable, legit structures in the country that can be used. I mean, we're doing business with our former colonizer. They should not be scared of us as if we are a foreign country that they've never really had any business interest with.
Dr. Mvuyisi Mzukwa, sir, thank you very much indeed for your time. Vice Chair of the South African Medical Association, his view on that at the moment. Well,